This is Urban Health Today, and I'm speaking with Maimah Karmo, best-selling author, cancer survivor, founder and CEO of the Tigerlily Foundation. She's here to talk about breast cancer awareness and the importance of and education about clinical trial participation within the Black community. It's a pleasure to have you here, Maimah. Thanks for speaking with me today.
Thanks for having me today.
All right, let's begin. So please talk about your background and what led you to create the Tigerlily Foundation.
So my mom is a nurse and she taught me a life-saving thing at 13 years old, how to do my own breast examinations. I didn't know that, I didn't understand why, but being taught breast examinations at 13 years old made it a habit, and ultimately it saved my life. Because at 31 years old, I was taking a shower and there was a lump in my breast. And my mom told me that if you ever find a lump in your breast or discoloration or discharge, you'll know something's wrong with your body. And so found the lump at 31, called my mom. I said, your voice was in my head. I know it's not normal. What should I do? So I went to see my OBGYN who said, this is not normal to have a lump in your breast at this age. But we can get you a mammography and get it screened. The only challenge was that mammograms are recommended at 31 years old. They typically start at 50 years old. And so we pushed for the mammography, and the insurance company fought us tooth and nail. But I fought back and got one, and it came back clean. And I said to the radiologist, you can't see what I can feel, so your test must be wrong. She kind of scoffed at me and kind of, blew me off. But the lump kept growing, and I felt uncomfortable about it. I wanted it out. And so I kept pushing for a biopsy, and over 6 months later, I got one. It turns out it was stage 2 triple negative breast cancer. Triple negative breast cancer is the most aggressive kind of breast cancer, particularly in Black women. And at the time, there was no treatment targeting TNBC in Black women or in any setting, in any woman, any color, race, whatever. And so although I had done my breast exams every single month, I knew my body enough to know when to ask for help. I advocated for myself. I had a doctor. I got a mammogram rather, and pushed for the biopsy. They told me that I could die within 5 years because no treatment targeted my kind of breast cancer. And so I was in a place where I thought, how many other young women are young and unaware they are at risk for breast cancer, whether or not they have family history, because history isn't always a precursor to diagnosis. How many don't know what TNBC is? We see all this pink ribbons and the walks and runs. People have no idea there's more than one kind of breast cancer, right? And
Yes,
I began to study several types. People don't know this. They think, we're going to walk, be aware of breast cancer, and then I'll be fine. Women under the age of who were my age didn't have access to screening. So if you found a tumor, you had discharge or any kind of abnormality, you couldn't get mammography. It wasn't covered by insurance. So women who were younger and who were underrepresented and or Black or brown were not able to get mammograms, right? Which means higher death rates. We had doctors who dismissed many women like myself, right? So I sat there and thought, if I have 5 years to live, what can I do to disrupt and change and give education and resources and hope to people who need to know what's happening so they have a better outcome than me and live longer than me.
Right.
And so one night I was just like, I said, well, if you don't have targeted treatment, what can I do? They said, we'll have surgery, take the lump out, chemotherapy, we'll give you whatever we have right now, and then radiation. So in the middle of chemotherapy, one day I just kind of fell to my knees crying. I lost all my hair and eyebrows, eyelashes, breast was scarred. I lost probably about 15 pounds within a short period of time from stress and the treatment. And I was just on my knees crying in the bathtub. And I just thought, this is not fair that someone could what if people don't know what to do or know what to do and still can't get the right treatments and access to screening, all these things. And I said, God, if I'm not going to make it, how can I use my life to help others who are in need? And if you're God, show me yourself and I'll do whatever you want me to do for the rest of my life. I went to bed that night and got up and I had the idea for Tigerlily, I'm like, well, God, what's Tigerlily? And it's really about giving women hope. The flower itself is a perennial. So when you're going through a treatment, you lose, like women are like flowers. We're fragrant, we're multi-dimensional. We're just like, we're very like, we can go through things and heal and grow. So the flower represented women's ability to, as you lose your hair, the flower itself, when it's fall and winter, that the petals fall off. And when it's spring and summer, they bloom again. So really giving women the hope that
Oh,
they can be more beautiful and strong and be transformed during and after breast cancer. And so what I began that in treatment and began going to churches and schools and hospitals, is talking about the importance of educating women about breast health and about risk reduction and about triple negative breast cancer. And the fact that I didn't have targeted treatment meant that there weren't Black women in clinical trials to be able to have the right treatment for their bodies. And so I thought trials before were for only women who were dying. That's not true. And so I had to get people to understand that all the things that happened in the past that are really, really bad things, atrocious things, that unless we take part in trials, we don't have treatments working for our bodies, especially Black women's bodies. And that's where the whole lily began to grow and flourish.
wow, that's a beautiful story. So you were only 32 when you were diagnosed, and your organization focuses on women under 45. Have you seen a trend one way or the other in the average age of cancer survivors you meet in terms of are they getting younger or is it staying about the same?
It's really sad. It's getting younger. I don't know if it's because of educate people are being they're more aware now, and they're advocating for themselves. They're checking, and then because what happens is people are getting diagnosed before later age and stage, right? But I think they may not have known earlier, so they were getting diagnosed when they were at later stage. So they may have had cancer at 25 or 30, but not being able to access mammography and get screened at until 40. They were finding it then at later stages. But I have a patient that I met who was 19 with breast cancer.
Oh my God.
And although that's not the typical thing, I'm seeing more women who are 17, 18, 19, 21. And it's heartbreaking because women who are younger tend to have more aggressive cancers, and they could be like me, they're in college. They don't want to lose their breast. They have a boyfriend saying, "Oh, don't lose your breast." They're newly married with kids. They're pregnant with cancer. Like me at the time when I first got diagnosed, literally before getting diagnosed, maybe like 6 months before, I had no insurance. I didn't think I needed insurance because I was young, I was healthy, I was
Right,
fine.
of course.
And then I had a cousin who worked in insurance, and she said, you need to get your health insurance through your company and then get life insurance just in case you have an emergency. And I'm like, I don't have any, I mean, I'm a runner. I go to the gym, I juice, I do all the things. And I remember her sitting with her in Starbucks, and then she was telling me like, you need to have insurance because things happen you never expect. And thank God for her. I got insured through my company's plan. And then I had life insurance that I got through her. That life insurance saved me during treatment. So I ran through my insurance. I ran through my savings account. I ran through some of my 401k. I ended up with, when chemo finished and treatment finished, I ended up with like 2 bags of bills from co-payments, prescriptions, and things like that, because I found out that, for example, I began having extreme nausea, and the medication that they gave me wasn't working for me. And they kept saying, well, this is what we're going to give you. And so I ended up getting another medication as just a couple of pills that work for me so I wouldn't throw up all the time. That medication cost almost $1,000 because it was not in my insurance plan. And so, but I needed it to get through. I had to work. I had to take care of my daughter. So I just went through all these savings, and I racked up credit card bills and so forth. But a lot of people can't afford to pay. They don't have credit cards or a 401k plan to go through. And so when people say Black women don't adhere to treat trials or treatments, it's not that you don't want to live. Nobody wants to die. But when you're looking at, for me, like, do I work, take care of my child, keep my home, keep us in a warm house and with food? Or do I take this treatment and not be able to work and function, take care of my daughter? What do I do? I did choose to go through all my savings and everything else to be there for her, but some people don't have that option. They may work 9 to 5 and they don't have insurance. They don't have a father at home or a mom like me who took me in to take care of me while I was trying to manage the whole process. And so these determinants of health really they force you into a corner where you choose between your life and your family, and that's not fair at all for anybody to have to do.
How do you talk to women about financial toxicity of cancer treatment? How do you talk them through that?
We offer assistance to patients going through financial challenges because that was one of our first programs. Because I remember thinking, if I have a decent job in insurance and supported home, and I'm in this, my financial my finances are in ruin because of treatment. What about a person, to my earlier point, who's working 9 to 5?
Right.
The hospital's like 5, 10 miles away. They're living in a place where they have to bus to get to treatment. They have 2 or 3 kids, no dad in the house. Like, how do you pay the co-payment, the prescriptions? How do you pay for a medication you can't afford because it's not in your plan, but you needed to be able to not throw up or not itch because you're having these side effects, or you have migraines, or you have just all these things, right? Um, we help them to fix the problem because sometimes there's no solution to financial challenges. You have to deal with that. Um, it's not fair. So we offer support through Tiger Lily. We also have people we work with who are partners that have programs that offer people financial assistance or rides or meals or whatever. So we really good about, kind of providing a hub for whatever you need when you're in this treatment phase. We can offer that to you. We launched a platform recently called a Raise platform, and people can go into the platform, enter their needs, and then you can go into the platform as a donor, whether it's you or someone else watching this, and say this patient needs, X, Y, and Z, and donate to the person's, their registry. And so they get direct support through Raise, they get direct support through our partners as well. But I think people think that some people are ashamed to ask for support. They're ashamed to say, I don't have, money for rent or food or utilities. So saying to people that, do not be ashamed. It's not your fault that you have cancer. Not your fault that you're in this position. You didn't choose to be here. We are a safe space for you to come to be able to breathe and to be able to help you navigate this journey. So I talked to a Black mom one time who ended up becoming homeless while in treatment.
Oh,
And she didn't want to
wow.
say she needed help because she was afraid to lose her kids. A lot of Black moms maybe lose their kids because they can't take care of their kids. And if you hear, imagine if someone found out she had, 3 kids in a car, and living in a car during treatment, she would have gotten her kids taken away from her. So it's just making people feel safe enough to know that we want to protect you and get you through this is what's really important. And knowing what to ask for help, what to ask for to get help, who to ask for help, and how to be confident in doing that and not being afraid to be penalized in some way. And also, it's not just to help during cancer treatment, because when cancer ends, you still have the bills. You have getting back on your feet.
Right.
You have the people think that when you ring the bell, that cancer stops. It doesn't stop then. The worrying starts. The side effects are still there. That will it happen to me again at some point when I'm not watching it, right? And then there is the psychosocial needs and so forth. There's body image issues. You lose your breasts, you're scarred, you can't have children maybe, and the mental health aspects of it. And so we as an organization help patients before they get cancer to have a risk reductive lifestyle, healthy lifestyle, to think about what they can do to limit the risk of cancer. We help them when they're in that process of like that trauma of cancer, to give them that space to come to feel loved and taken care of. And we help them afterwards as well. And at the center of our work is we always say we're heart-based. We want you to come to our website, open the website, and just see that you feel like you're loved, taken care of, and that you're cared about.